Facing a medical procedure like surgery can bring many questions and some natural anxiety, especially when thinking about what comes next. Understanding the recovery process is a big step in feeling prepared and empowered for your journey ahead. A modified radical mastectomy affects recovery primarily by requiring a period of physical healing from the surgery itself, coupled with emotional adjustment to body changes. This recovery typically involves managing pain, regaining arm and shoulder mobility, and monitoring for potential complications. The reason recovery often takes several weeks to months is due to the nature of the surgery. A modified radical mastectomy involves removing the entire breast, along with most of the lymph nodes under the arm, but it spares the chest wall muscles. This significant removal of tissue and lymph nodes means the body needs time to heal the surgical site, regenerate damaged tissues, and adjust to the altered lymphatic drainage system. The absence of pectoral muscle removal generally makes recovery quicker and less painful than a traditional radical mastectomy. To navigate this recovery effectively, you will want to focus on several practical steps. Pain management is crucial, often involving prescribed medications initially and then over-the-counter options. Your medical team will likely provide guidance on gentle arm and shoulder exercises to help prevent stiffness and restore range of motion. Caring for surgical drains, which might be in place for 1 to 2 weeks, is also a key part of daily recovery at home. Additionally, watching for signs of infection like unusual redness, swelling, or fever is very important. An important aspect of recovery that often goes beyond initial healing is the potential for lymphedema, a swelling that can occur in the arm or hand due to lymph node removal. Your healthcare team might discuss prophylactic measures or recommend a specialized physical therapist, often called a lymphedema therapist, to help manage this risk. Another consideration is breast reconstruction, which some individuals choose. This can begin at the time of the mastectomy or later, and it will introduce its own recovery pathway and considerations. Ultimately, recovery from a modified radical mastectomy is a unique and personal journey that blends physical healing with emotional strength. By actively participating in your care, following your medical team's advice, and seeking support when needed, you can move through this period with confidence and focus on your long-term well-being.